More than 2,100 COVID-19 deaths were reported in the United States on Tuesday, making it the deadliest day the country has seen in 6 months. The virus continues to hit hard in America's heartland. Record numbers of COVID-19 deaths have been reported in at least 9 states, including Maine, Wisconsin, Missouri, and North Dakota. Data shows the Dakotas currently lead the world in COVID-19 deaths per capita. This all comes as millions prepare to travel and gather for Thanksgiving. Our David Begnaud leads our coverage from Fargo, North Dakota.
Did you know that right now the Dakotas, both north and south, lead the world when it comes to the number of people dying on a daily basis per capita? Now that's a fact. But there will be people who listen to that and say it's fear-mongering, it's fake news, or they'll just look the other way. That is the reality in this part of America, both of the Dakotas. I talked to a well-known radio host. He's a Democrat in a richly red area. And I asked him, how do you think North Dakota is handling the pandemic?
If you were grading it, it would be an F, probably an F-. It's that bad.
Joel Heitkamp hosts the #1 talk radio program in North Dakota. The former Democratic state senator takes tons of calls about COVID every day in a largely Republican state.
And you have a right to call into this show anytime you want.
Well, the height of hypocrisy in North Dakota right now is how we care for our elderly. If you go into Costco, you go into Walmart, you go into any of these places, they say put your blank mask on, you're going to put it on. But you know what? They're not willing to do that around Grandpa and Grandma after they've been out in the bar. And I can't figure it out.
Just yesterday, North Dakota reported 37 new COVID-related deaths. That is a new high. They have the second highest mortality rate in the world, and some of their hospitals are overwhelmed. That's why the U.S. Air Force has sent 60 nurses to help staff hospitals around the state. In South Dakota, the debate over wearing a mask continues statewide.
I think if we choose to wear it for our own protection, that's on us. But to force us to wear it, I'm against that.
Around 50% of South Dakotans say they do not wear a mask. Kelby Krabenhoff, CEO of Sanford Health, the largest health system in the Dakotas, suddenly retired last night after creating a firestorm this week by saying he wasn't going to wear his mask at work because he had recovered from the coronavirus and was immune. Now, in a statement, his own health system said they had mutually agreed to part ways and that his views didn't reflect those of the company. He also downplayed the seriousness of the pandemic to our Sioux Falls CBS affiliate, Kelloland.
It's hard for me to say we are at a crisis. That would be misleading from a clinical standpoint.
He is not a doctor, but his chief medical officer, Allison Suttle, is. I asked her,
would you classify what is happening here in the Dakotas as a crisis?
I would.
36 hours after she contradicted her CEO on CBS This Morning, he is gone. Dr. Suttle is also calling on South Dakota's Republican Governor, Kristi Noem, to mandate masks statewide. But the governor refuses to. North Dakota's Republican Governor, Doug Burgum, did that 2 weeks ago.
How much is Trump's messaging affecting local politics here in North Dakota?
It affects everything here in North Dakota. If he tells a lot of these folks that the science doesn't back it up, or that you can shove a light bulb up your keister and it's all going to make things better, some people here are going to believe it.
We hear that loud and clear. And please don't shove anything up your keister to protect yourself from COVID. It's not going to work. One more story before we go. Yankton, South Dakota, small town in the southern part of the state. They met, the commission did, the elected officials met to decide whether or not to implement a mask mandate. They decided against it, and the local newspaper said they wanted more time to educate folks. Here is a sincere question. How much more time do you need to educate people that masks matter? We're 8 months into the pandemic, 225,000 people plus have died. How much more time do you need? Vlad and Anne-Marie, back to you.
It's a great question, David. Let's get into it with immunotherapy researcher and Dr. Leo Nissola. He is joining me now to talk about this. So, Doctor, we could be getting closer to a coronavirus vaccine with some promising results from Pfizer and others. Yesterday, the CDC director, Dr. Robert Redfield, says he sees the first vaccine doses being rolled out the second week of December. Now, Moncef Slaoui, who leads the vaccine development for Operation Warp Speed, was asked about the timeline on CBS This Morning. I want to play a bit of what he said, and we'll talk about it.
We should be
I hope, close to an approval first of the Pfizer vaccine that has shown 95% efficacy. Will be reviewed by the FDA on December 10th and maybe on the 11th or the 12th approved. Within 24 hours from approval, we plan to distribute the vaccine. In the case of the Pfizer vaccine, Pfizer themselves will be shipping the vaccine doses to the exact location that each state will have identified as the areas where they want the vaccine doses. The doses will be proportionately to the population distributed for each state.
So, Doctor, we're potentially just weeks away from a vaccine. Who would be eligible to receive the first doses?
Hi, Vlad. Good morning, and thank you for having me. I think overall this is really good news. I think we're all ready for a vaccine. And when the FDA approved the emergency authorization for it, things would start to feel a little different. So vaccine distribution has been discussed widely, and I think it's very difficult to say who should get the first doses of vaccine without seeing the results from those vaccine studies. You see, we need to know what the vaccine safety profile is when it comes down to the vulnerable population. So postulating that this vaccine is safe and effective in the elderly, most likely, folks that are living in nursing homes and healthcare workers should be able to receive the vaccine first.
All right. So yeah, I guess the question that is sort of on my mind, Doctor, is we keep talking about the great and wonderful news of these vaccines, but that to me still seems kind of far away because Thanksgiving is tomorrow and Christmas is in a few weeks. And people are behaving, as you heard in that piece from our correspondent, David Begnaud, as if either the vaccine's already here or that they still need to wait for the information. We know the information. The CDC and doctors ranging from Dr. Deborah Birx to Dr. Anthony Fauci to Dr. Robert Redfield, they all say that the mask, wearing a mask, is probably the best thing you could do. It probably is even better than the vaccine because it protects those around you. So why are people still not getting that message?
Well, I completely agree with you. And the current COVID-19 statistics in the United States are shocking. The United States are seeing more cases of coronavirus than ever before. And if 1,000 deaths a day won't make you wear a mask, I honestly don't know what would. We have flattened the infection curve before, and we could do it again by collectively practicing how we know to slow the spread of this virus. That is wearing a mask, washing hands, avoiding gatherings and indoors. But some parts of the population are not doing that. So I think we're running out of options to convince the public because we have limited our stamina for it.
Let me ask you about side effects. The doctors who met with the CDC advisors said this week that the pharmaceutical companies should be transparent about any potential side effects people may experience after getting the first dose. Pfizer and Moderna have both acknowledged that their vaccines could have or induce some side effects. You know, I mean, if the side effects aren't life-threatening, you know, should that matter to people?
Well, in clinical studies, especially in vaccine clinical trials, there is extensive clinical data review, and usually there is a standard review process to look closely at the safety data, and that includes understanding potential side effects. We have yet to see those papers, and we have yet to see the published data, but so far, I'm not concerned. I think transparency is essential in times like this, especially when some are trying to politicize science. But the good news is that vaccine developers have committed to be completely transparent and to make the data available for scientists, and they will follow the standard safety review processes.
Let's talk about kids. The state of Tennessee says once a COVID vaccine becomes available, it will be optional in K-12 schools. Should kids get vaccinated, and are these vaccines safe for children?
So we don't know that yet. Again, the data from those trials have not been published, but let's be clear. We need robust national vaccination campaigns. I think mandates and tactics to compel vaccinations in more intrusive ways, like limiting access to services or jobs, are tricky. In times that society is very polarized, I'm not sure how mandates would play out. And I think this is a time for us to bring people together and continue the messaging that vaccines save lives and everyone should gather around on the same tent.
It's a good message. The CDC is also considering new guidance to reduce quarantine time if someone was possibly exposed to the coronavirus. So this is sort of interesting. And I know that, there are people, because we've politicized this pandemic so much, not we, but our politicians have politicized this pandemic, that there will be some people that will say, you see, you didn't need to quarantine or isolate in the number of days that was previously stated by our medical professionals. But Doctor, just before we get into this question, remind our viewers again that there is still so much that we don't know about this this virus. There's still so much that we're learning. You, as a medical professional, are learning every single day. So now the question, why would the agency consider shortening the advised quarantine time to between 7 and 10 days as opposed to 14 days?
Well, you're completely right. There is no shortage of unknowns when it comes to COVID. But at this time, it makes sense to see the CDC evaluating the evidence to shorten the quarantine timeline. I think the vast majority of people get infected in the first 3 to 5 days, and the practicality of a 14-day quarantine during the winter it's very difficult for some people to comply. And I think as we're headed into a more difficult season, shortening the quarantine time makes sense.
Yeah, I mean, I just have to go back to what I said earlier. I mean, a lot of what the medical community, the CDC, is asking of Americans is to be cognizant of those around you. That's really what this is all about, right? It's not about how you feel or how the virus has affected you. If you are, sadly, tragically unlucky enough to be infected with coronavirus, but you don't show any symptoms and you get through it without any problems, that's great. And in 10 days, you feel fine, you feel like you're ready to get back to work. That's wonderful. But what about the people around you who may not who may be more vulnerable to the virus and who are not going to be blessed with, the fact that you were able to get through it without any issues? That's sort of what I keep thinking about.
That's right. And I think it's a collective effort. But here's what we're missing. We need to allow COVID testing at home without a doctor's order. This is not the time for us to be gatekeeping tests from people. Folks at home should be allowed to get those tests over the counter. We can stop outbreaks if we understand where they are. And I think if you test positive for COVID, there's no one in their right mind that will get out of the house. So I think the FDA should update the guidance on testing and let people buy COVID tests over the counter.
All right, Dr. Neil Nissola, we appreciate it as always. Have a wonderful Thanksgiving. Thanks for being with us.
Thank you. Stay safe.
You too.
Happy Thanksgiving.
Happy Thanksgiving.